Hi everyone. Did you know that nearly 1 in 300 dogs will be diagnosed with diabetes at some point in their lifetime? Diabetes affects dogs in the same way that it affects humans. It means that your body has an inability to process its sugar levels. And so dogs are typically insulin dependent, just like humans are. Tonight I'm going to be sharing with you how to properly and safely administer a dose of insulin to a dog. In order to get started, we first have to make sure we have everything we're going to need in order to administer the injection. And that includes your vial of insulin, the syringe you'll be using to administer the insulin, 2 alcohol prep pads, and the sharps container for safely and properly disposing of your syringe when you are done. This is Dexter. Dexter is diabetic. He was diagnosed at the age of 2 with diabetes, and he requires an insulin injection twice a day, every morning and every evening after he eats. So this is how we're going to get started. The first thing to know is the proper storage and handling of insulin. Insulin must be kept cold. It has to be kept in the refrigerator. It's very important that it's never exposed to heat, sunlight, and that it never has an opportunity to be frozen. Also, very important to note that insulin vials cannot be shaken up and down. This will separate the liquid that's inside, and it will not be absorbed properly. So when you're preparing your insulin for the injection, you remove it from the fridge and you gently roll it in your hands. This helps incorporate the 2 different liquids that are inside so that you're not shaking it and potentially separating the liquid. The other important thing to know is the different parts of a syringe and how to properly hold it and handle it so that you keep yourself and your dog safe the entire time. So different parts of the needle or of the syringe include the needle, which is under the cap here. That is the very tip of it that you will inject into the skin of the dog. This is called the barrel of the needle, and that is what you're going to look at when you are preparing your dose. The other important part is the plunger, which is the movable part that goes up and down on the syringe. These are all important things to know so that when you're administering, you make sure that you are dosing your dog properly. So to get started, we are going to open up an alcohol prep pad and prep the top of the vial to disinfect it. Once that is complete, you're going to prepare your syringe. To do that, you will remove the cap and place somewhere that's going to stay in your reach. You need to inject the same amount of air into the bottle as the amount that you're taking out. This will prevent a vacuum situation and possible cracking of the glass vial. So for Dexter, he gets 6 units twice a day. So you need to pull back on the syringe to the 6-unit mark. Once you have filled the barrel of the syringe with air, you're going to pick up your clean vial of insulin and turn it upside down so the liquid comes to the top. You're going to insert your needle into the vial and push in the air in the same amount of the liquid. You are then going to pull back on the plunger to your 6-unit mark, fill it with the syringe, and make sure that there are no air bubbles. In order to do that, you may have to push the liquid back in and then redistribute the 6 units. As soon as you're sure there are no air bubbles, you remove the needle from the vial. Other important things to note are the comfort of the dog. So for Dexter, we use the nape of his neck for his injection. In order to properly administer this without it hurting him, I kind of rub the area a little bit first. This just helps bring some warmth and help the blood flow in the area where we're going to administer the injection. You need to make sure at this point that both of your hands are free. you need one hand safely on your needle to be able to inject the medication, and the other hand on the dog to not only control his position, but to make sure that you're properly holding the skin so that it doesn't hurt. You're going to, after you give him a little bit of a rub so that he gets a little bit more comfortable, I usually tell Dexter it's time for his medicine, and he knows what that means at this point, so that helps relax him as well. You're going to pinch the nape of his neck in between your index finger and your thumb of your non-dominant hand. You want your fingers to be about 2 or 3 inches apart to allow yourself enough room to make sure you're not going to hurt yourself when you're doing the injection, but also make sure that the skin is pinched so that you have a firm surface for the injection. So we're pinching his skin just a little bit, not too tight, enough that you have control. The needle goes into the skin, and then you're going to push down on the plunger to insert the 6 units of insulin. You then quickly pull out the syringe, and you're going to rub the spot where you just did the injection. This helps to make sure that the medication that is now under his skin is being distributed properly, and it helps him feel a little bit better as well. You're now holding an uncapped syringe, which can be very dangerous. So this is a very important part of the process as well. You are going to recap the syringe, so now it's a little bit safer. You're going to properly dispose of it in a sharps container. This then gets emptied at the vet about once a month, and they can dispose of the syringes safely for you, but this gives it a safe place for you to keep it until you're able to do that. The last part of the process is taking your second alcohol prep wipe and wiping the top of the syringe again. This just helps ensure that the top and the cap of the vial of insulin are properly sterilized before you go and touch it again. So that's it. It's pretty easy. I know it can sound a little intimidating, and if you're not used to or have experience with needles, it can be a little bit scary and a little daunting. But I hope that this information provides you with some insight into the daily struggle of taking care of a diabetic dog, but also helps you feel a little bit better about how the process can be pretty easy and not traumatizing for you or for the dog.